Hey everybody, my name is Dan, I'm a veterinarian, and welcome to my video. Today we're going to talk about your doggy having blood in the urine. A veterinarian is worried about bladder infections, cystitis or inflammation in the bladder, and also bladder stones. Now, there could of course be a handful of other things going on that are less likely, but these are the three things that we commonly see in cats and dogs, and it can be really scary. What a veterinarian is going to do, guys, is they're going to first do a urinalysis. That means they're going to pull some urine. It runs through a fancy machine now, and that fancy machine is going to do all the work for your veterinarian. The urinalysis is going to help to diagnose a UTI or a bladder infection. Based on if you have red cells, white cells, bacteria, what have you, it's going to be paramount in that first step. The most important thing we're going to do, guys, is a urinalysis followed by some sort of imaging. You need to do imaging, guys. That includes either an ultrasound or a radiograph or an x-ray. This is going to rule out bladder stones and give the veterinarian an idea what the bladder looks like. Ultrasound is really easy, and most veterinarians have it now. All they're going to do is when they're collecting urine, they're going to ultrasound the bladder, and if they see any stones or a thickened bladder wall, all that's going to help them to figure out what is going on, UTI, cystitis, or a bladder stone. Now, in most cases, you can just start off with a urinalysis and some imaging to have a really good idea of what's going on with your doggy or your kitty. Of course, there's additional tests you can do, like a urine culture or additional lab work, but that's all contingent on what your veterinarian sees on the physical exam, what you're noticing at home, and if they think it's warranted to do additional tests. Once you're done, the veterinarian will go over antibiotics for a UTI. If it's a mild UTI, they may do amoxicillin. If it's a more complicated UTI, they may do Clavamox or Augmentin. If it's a really nasty UTI like rods, they may even do a fluoroquinolone like enrofloxacin or marbofloxacin. Now, if there's a stone, they will go over foods to help with reducing stone formation, improving the bladder health, and then they will go over surgery. In most cases, surgery is needed for bladder stones. Most bladder stones don't just magically dissolve. However, you can always monitor and see if the food helps, but most veterinarians will encourage a cystotomy to get in there and remove the bad stones. As always, guys, if your doggy or kitty has blood in the urine, that should be looked at as soon as possible. As long as your kitty or doggy is peeing on their own, it's not considered a medical emergency, like need to be seen in the next couple minutes, but you should call and try to get an appointment the same day to get this thing figured out. Always consult your veterinarian, always call your veterinarian. There's a lot of veterinary services, including our own, that do some kind of messaging option. Reach out, connect, and figure out what's going on. As always, guys, my name is Dan, I'm a veterinarian. Thanks for watching. I really appreciate you guys. You guys take care. Bye.